started the recording, so we'll start. Bismillahirrahmanirrahim. So last time we were covering marijuana, weed, and hashish and cannabinoids. So I will start from this slide. I hope I have covered the slides before that. Marijuana and the brain, or hashish and cannabinoids and the brain. So there are four structures of the brain that are involved, considered to be involved in cannabinoids. One, cerebellum. By binding with the cannabinoid receptors, THC interferes with the normal function of cerebellum, which controls the balance, posture, and coordination. Two, the cannabinoids affect the hippocampus. So THC activates cannabinoid receptors in the hippocampus. This affects memory by decreasing nerve cell activity in this area. Short-term memory is the first to be affected, and studies on lab animals show conclusive long-term memory damage. So unfortunately, the concept that it enhances the memory, the scientific evidence is contrary to it. Then cerebral cortex. THC affects areas in the cerebral cortex that are responsible for the sensory perception. As a result of marijuana use, sense of taste, sight, smell, hearing, and touch may be altered. Cerebellum, hippocampus, cerebral cortex. Cerebral cortex affects the taste, sight, smell, hearing, and touch. And limbic system, the most important part of it. Limbic system, recent studies in animals suggest that THC produces changes in the limbic system which governs our emotions. These changes, which are most evident during withdrawal from THC, are similar to those observed after long-term use of cocaine, heroin, and alcohol. So this is an important component that although people feel that it enhances the memory, actually it is the scientific evidence is contrary to that. So the THC affects cerebellum, which makes you off balance, hippocampus, which compromises the memory, cerebral cortex, which compromises the sense of taste, smell, sight, etc., and limbic system, which governs our emotions, is affected too. So things are relatively complicated. Now, the major risk for using cannabinoids, although it's legal in a number of countries across the globe, but there is a lot of research going on about the actual problematic issues related to weed or cannabinoids. Lung damage from inhaling the smoke, similar to smokers. So it's not very much different from smokers. It is very surprising. Once, long time back in 1960s, the smoking was considered to be the treatment for asthma. Now, actually, we all know it's contrary to the fact, but it was used. It is just like a similarity, just a German Shepherd, a dog breed, is considered to be originating from Germany. It has no relationship with Germany. So German Shepherd is a breed of a dog which actually has no background with Germany. Same goes here. People feel that it helps, but it actually compromises. THC causes blood vessels to relax, which in turn can lower the blood pressure, decreasing blood flow to the heart, causing the heart rate to go up by about 10 to 20 beats per minute. Not enough to cause trouble for most people unless you already suffer from restricted blood flow to the heart. So cannabinoids may also cause a heart attack by causing plaque inside an artery to rupture and form a clot, which in turn can block blood flow to the heart and muscles. The amount of the tar inhaled in cannabinoid smoke and the level of carbon monoxide absorbed is 3 to 5 times higher than tobacco smokers, probably because people who smoke pot tend to inhale more deeply and hold the smoke for a longer period of time, which unfortunately compromises the situation. This is the new evidence released just in February 2021, and it can be seen at a reference place in Canadian guidelines for use of cannabinoids. एक ये छोटी सी छोटी नहीं नज़म है, लेकिन इसको जल्दी से पढ़ देता हूँ सो दैट वी कैन प्रोसीड फर्दर. थकन बहुत है, जलन बहुत है, अधूरेपन की चुभन बहुत है, नकारे दुनिया नकारे जाना, ना कोई अजर है कोई बहाना, अजीब आतिश फसां सी हलचल, हबस की रुत में तिश्न बादल, तीरगी है खामोशी है, नींद की मुझसे दुश्मनी है, बदलते पहलू यूं रात गुजरे, सवेर का जब दीदार होगा, कभी तो आओ और आके देखो नजारे मेरी आरामगाह के. Cocaine. Now this is again a very commonly used drug, and it acts as a stimulant that produces general increase in neural and behavioral activity. Stimulants differ greatly in their potency. So Coca-Cola is a stimulant as well because it contains caffeine, as we have mentioned it earlier as well. Cocaine, most commonly abused stimulant prepared from the leaf of coca bush, found primarily in Peru and Bolivia. For centuries, a crude extract called coca paste has been made directly from the leaves and taken orally. Today, it is more common to extract cocaine hydrochloride, a white powder that is referred to as cocaine. Cocaine is typically administered by inhaling, snorting, or injectables. It can be converted to a base form by boiling it in baking soda until the water has evaporated to produce crack, which can be smoked as well. So crack is very impure, so its potency is highly variable. So cocaine is usually a white powder, which is people sniff, but it can be injected, and when it is smoked, the modified version of cocaine is called the crack, right? Crack is also cocaine. It's cocaine delivered in highly potent and rapidly absorbed form. Crack is a smokable form of the same drug. It's not just smoking cocaine, burning cocaine powder destroys the drug. Mixing cocaine with the right household chemicals to produce a smokable form similar to free-based cocaine is the science of making crack, rock, wash, or stones. These are various names given to the same compound. When crack is heated, it produces smoke containing cocaine, which usually has a purity above 90%. When the smoke is inhaled, it passes into the bloodstream through the lungs and quickly reaches the brain, quickly as in within a heartbeat of 1 or 2. So it just goes up in the brain immediately. So the effect comes very quickly. The high is also very brief, 15 minutes or so, when one feels immortal, and then it is very fast, plummet back to earth and mortality. So once it takes you above the skies, as soon as you inhale it, and you feel you are out of this world, you are immortal. But then the effect disappears very quickly as well. And you come to the base and you feel that you are again having the same problem. So you keep on smoking and it's a vicious circle. The compulsions to re-experience the crack high is very strong. It is very addictive form of cocaine. Many crack users also developed a habit for heroin to lessen the impact of come down from the crack high, and that is called smackdown. Cocaine hydrochloride is an effective local anesthetic and was once widely prescribed as such. Today's synthetic analogs, procaine and lidocaine, are more commonly used. So when you give the local anesthesia, it is lidocaine. Lidocaine in the form of a liquid injectable, which you give for a local anesthetic. It numbs the area and you can perform the small surgical procedures afterwards. So most of the doctors know about it. It works as an anesthetic by blocking sodium channels. People are more interested in taking cocaine for its psychological effects, the effects that you are high and immortal. These include increased self-confidence, alertness, energy. It tends to make people more friendly and talkative, but they are also more fidgety, sleepless, and have suppressed appetites. Users typically go on cocaine suppressed sprees, binges, where high levels of intake are maintained for periods of day or two. So most of these people, they have cocaine in the form of in a kind of a bottle or a filler. They take it out and they keep sniffing it throughout the day once you are addicted to it, because you want to remain high and immortal rather than on the ground and mortal. Due to rapid tolerance, increasing doses are used in a spree until either one's money runs out or serious toxic effects begin to develop. Common side effects from cocaine spree include sleeplessness, tremors, nausea, psychotic behavior. Together, this constellation of symptoms is known as cocaine psychosis. Cocaine psychosis is often mistaken by paranoid schizophrenia. So if you rule out the substance abuse and substance use disorder, only then you can diagnose schizophrenia or psychosis. But if it is drug induced, like with cocaine, you wait till the time it weans off and the psychosis clears up. Cocaine sprees can lead to loss of consciousness and death from seizures. Although tolerance develops to its psychological effects, repeated use actually sensitizes the subjects to its motor and convulsive effects. Fatalities are most common following IV injections, but snorting can damage the nasal membranes and smoking can damage the lungs. Both snorting and smoking cocaine are safer than IV injections, though. Withdrawal symptoms include a negative mood swing and insomnia. Pharmacological effects of cocaine effects. So lidocaine is the key, a local anesthetic. If you see the effects of lidocaine, you will be able to understand the pharmacological effects of the cocaine. Cocaine facilitates catecholamine transmissions in the brain by blocking the reuptake of dopamine, norepinephrine, and epinephrine. Blocking reuptake means that catecholamines remain in the synapse for longer periods and can therefore exert their effects for longer periods. But there may be more to story than just an effect of the catecholamines. ये मैं बाद में पढ़ूंगा. In one study that highlights glutamate's important role in addiction, researchers found that briefly stimulating nerve cells in the hippocampus, a brain area important for the memory and rich with glutamate, causes rats to frantically search for cocaine. They believe that hippocampus stimulation creates a release of glutamate as well as prolonged release of dopamine by tapping into circuit of nerve cells linking the ventral tegmental area, जिसकी हमने पहले बात की थी, of the nucleus accumbens, briefly stimulating the medial forebrain bundle, thought to create pleasure and a brief dopamine release, but no glutamate activity causes no searching effect. Amphetamines, they are again, they are difficult to be found in Pakistan, but amphetamine is used as a treatment for ADHD. Amphetamine and its relatives are other major forms of stimulants that are commonly abused. The effects of amphetamines are similar to those of cocaine and produce a syndrome called amphetamine psychosis. So just look at it. Most of these substances are affecting the catecholamines or the dopaminergic system, and they all causes psychosis-like picture. So the substance use disorder is commonly evaluated from this point of view. The effects of amphetamines are similar to those of cocaine. It is usually taken orally in the form of D-amphetamine and has been popular since the 1960s. In the past decade, amphetamine has been replaced as the most widely used drug by much more potent methamphetamine. Like crack, smoking methamphetamine is its crystalline form produces immense, highly rapidly with the same problems. So animal research has also shown that amphetamine use destroys serotonergic neurons in the brain. This may produce long-lasting psychotic-like effects. Ecstasy. Now the problems with these pills, which is also called e-pills, ecstasy, is that you don't feel drugged, you don't feel that anybody cannot say anything about it, so somebody looking at you won't feel that you are drugged. This is the complication with ecstasy or e-pills. Ecstasy is MDMA, 3,4-methyl endoxymethamphetamine, is taken orally in the form of a tablet. Like other illicit drugs, unreliable manufacturing can lead to wide variation in dosage in individual pills. Most pills contain other drugs too. So adulteration to make it more complex and give you more boost, it's very common. So MDA or MDEA, amphetamine, speed, ketamine is also added into it. Or even LSD. Some pills contain MDMA at all. No MDMA at all. Lots of people using ecstasy describes feeling of universal connection. Now this is the height of it, that you are connected to everyone. Lots of people using ecstasy describe it as universal connection, closeness, excitation, euphoria, rush of energy. People feel disinhibited, talkative, and keen to talk about personal things in a way that seems deep and significant to them. So they start talking about themselves as somebody who is out of this world, and they feel connected to everyone. And the feeling is that everybody is understanding whatever you are saying, but actually you are not making any sense out of it. Ecstatic. Ecstasy has both stimulant and hallucinogenic qualities. Some pills cause a distortion of sound and vision. These distortions are caused by pills that contain chemicals with more potent hallucinogenic properties, including drugs like LSD or ketamine. The effects usually last for 4 to 6 hours. So when you take a e-pill, it goes into your stomach, metabolized in the liver, goes to your brain, and the effects start and last for 6 hours. It's just like any other drug. Stays in the system for 6 hours. And you feel again euphoric, good, talkative, happy, connected, and you enjoy that feeling. Of course, this feeling is enjoyable to everyone. But unfortunately, again, it damages the liver, it damages the brain, it affects the serotonergic and dopaminergic system. Ephedrine. I remember a few years back, there was a big scam of ephedrine smuggled to Pakistan in a big containers, and lots of things were said about it. So ephedrine is a stimulant as well. Ephedrines are sold in a variety of brands. Previously, it was pseudoephedrine is part of the component of all the flu pills as well. So, which is unfortunately a stimulant. So when you take the flu pill, you feel good, your flu goes down, you feel comfortable, and things are relatively better. Ephedrine alkaloids are amphetamine-like compounds used in over-the-counter and prescription drugs with potentially lethal stimulant effects on the central nervous system and heart. The FDA has received more than 800 reports of adverse effects associated with use of products containing ephedrine alkaloid since 1994. And it causes the same problems: neuropathy, myopathy, psychosis, stroke, memory loss, heart rate irregularities, insomnia, nervousness, tremors, seizures, heart attacks, and death. So you have to be careful in using ephedrine as well. And again, as I mentioned to you earlier, e-pills, ephedrine, and all of these compounds make you very happy, connected, comfortable, but unfortunately they destroys lots of things in our nervous system. Opiates, heroin and morphine. Opium is the sap that is exuded from the seeds of opium poppy. So the poppy plant contains multiple things. So the poppy plant has flowers, buds, then components of the flowers, leaves, stems, roots, and everything related to poppy plant is used as addictive agent one way or the other. And locally, when I was young, my dadi used to make khas ka halwa. And I was surprised because after taking that halwa, it was so tasty that we used to enjoy it. I think it is still available, khas in lots of places, but it is not as frequently used now, khas ka halwa, as it was used earlier. So that is actually an opioid, and it is the dried component of the leaves of the opioid plants which is used as khaskhas. Opioids are unmatched as analgesics. We still use it as a painkiller and extremely effective in suppressing coughs and diarrhea. And previously, opioid tablets were used to control the diarrheas in the children. So when children develops diarrhea, a small amount of opioid was given to them and the diarrhea stops or the pain stops. And if it intractable cough, you take a small amount of opioid and your cough is gone. So that is again, unfortunately, a tricky situation. Sorry. I hope you are still able to see these slides. Okay. Three historic events that have led to the widespread use of opioids. 1644, the Emperor of China banned tobacco smoking, and addicted smokers switched to opium and liked it. In 1803, morphine was isolated from opium and by 1830 became widely used. So medicines, herbs, pain, cancer, anything, and you give opium and or opioid derivatives, and they are good painkillers. They are still used as painkillers, and morphine, hydromorphone, and related compounds are related to it. So lots of people were using it in number of other situations. Sorry, ephedrine I covered. Yes, I covered ephedrine, so why I went back. Okay, opium use. Widespread until 1900s. Opium was commonly sold in cakes, candies, wines, over-the-counter medicines. Again, was popular mixing it with alcohol to have good effect and things like that. And cough syrups included opium. The stomach syrups included opium. And there were lots of other compounds available over the counter which can be used to treat number of things. Opium is unfortunately going down. The use of opium as an addictive drug is going down. Why? Because one, it is difficult to get the opium, purify it and use it. And number two, because of these fancy pills like ecstasy and other drugs, opium is relatively crude drug. I remember when I was working as a resident in psychiatry, Professor Malik at Mubashir's ward, Allah Jannat Nasib Kare, I used to see one Buzurg who was 107 years of age, and he was an opioid dependent. And I was officially asked by my professor that you should keep providing him opioid. वो एक सरकारी इनकम टैक्स की ओपियम टैबलेट्स मिलती थी जो हम हर हफ्ते उनको दिया करते थे. He used to come all by himself, used to pay for the opium tablets, and he was taking it. And when I asked him why this gentleman is given opium at the age of 107, so the answer from my supervisor was that we cannot stop it at this age. If we discontinue it, taper it off, or stop it, he will die. And this was unfortunately the problem. For all those 5 years when I was in Institute of Psychiatry in Rawalpindi as a trainee, I kept on providing him officially the drugs, opium, and he was taking it, and he was fine. He was surviving still at the age. What happened afterwards, I don't know. So unfortunately, the addictive properties of opium are still complicated. सुकून दिल के लिए कुछ तो एहतमाम करूं, ज़रा नज़र में जो मिले फिर इन्हें सलाम करूं, मुझे तो होश नहीं, आप मशवरा दीजिए, कहां से छेड़ूं फसाना, कहां तमाम करूं. The rush, the effect of opioids, most valued by user in the rush, a wave of intense abdominal orgasmic pleasure that involves state of serene, drowsy euphoria. Most of the people that take opium, they feel relaxed, comfortable, euphoric, down, quiet. It's not like the synthetic drugs like ecstasy and other drugs. These effects draw in the people use the drug more often and tolerance develops. This leads to increased dosage and switches to more potent drugs, for example, from opium to heroin. Now, because this is not very common, the opioids, so we don't know. But again, lots of recent research needs to be done on these drugs and more direct routes of administration. So opium was usually taken as a tablet form and an oral pill, and people used to describe it as a grain, a small grain. How much do you take? Do chana. How much do you take? Ek chana, subah sham, or do chane, subah sham, or do chane rozana raat ko. That was the terminology used at that time. I don't see people saying it now anymore because probably that opium form is not available. Lots of the crops were destroyed, it was banned, and nothing coming up. So now the fashionable synthetic products are taken up with but instead of these, again, natural grown plants. The physical dependence that builds up adds to the already high motivation to take the drug. And next thing you know, you are an addict. Opioid addiction is actually quite high amongst healthcare professionals. The main risks are quite minor: constipation, pupillary constriction, menstrual irregularities, and reduced libido. The withdrawal. Again, classic withdrawal: increased restlessness, watery eyes, nose, yawning, sweating, sleep disturbances, chills, rigors, dilated pupils, muscle spasm. Symptoms abate mostly in second or third day. So if somebody is taking an opium and it is stopped suddenly, all of these symptoms last for 3 to 4 days and then they disappear. But unfortunately, if it is adulterated, then things are relatively complicated. Now, the last part of the addictive thing, the treatment. So I have told you number of addictive substances, including ephedrine, ecstasy, opioids, and so many other as well. And now I will briefly touch down about the treatment. This topic is still not completely covered, but I hope most of the areas are covered relatively well for you to know that these are the addictive things. Every patient is required to follow the rules within the recovery program to avoid any chances of relapse. This is unfortunately very tricky. We see lots of people going to these so-called Nasha Chhod clinics. And when these Nasha Chhod clinics keep people, what they do is that they give lots of antipsychotics, make people sedated, keep them there for months and months, and people come out and they start taking the drugs again. So basic target is to prevent the relapse. And the residential drug addiction treatment programs generally offer varied therapeutic sessions that assist individuals in enhancing their health. So they go for multiple options. Let's talk about some of them. So detoxification. What is detoxification? It's a very common question asked in psychiatry. Detoxification, and that is a very common word used in psychiatry as well, to detoxify. What does detoxification means? A safe detoxification process is initiated, overseen by a medical doctor and a nursing team. Now, you have to understand that detoxification is a complex situation where medical people and the nursing staff and a holistic approach should be there. Once this has been in place, successfully achieved, the patient is ready to start with the program. There are several types of detoxification processes carried out which offer help from drug addiction. Now, this is again important. We usually consider detoxification as a process of just stopping the drug and compensating for the treatment. Actually, it is not like that. So you have to understand. Okay, so detoxification. One, short inpatient treatment. Two, the outpatient treatment for a longer period of time. Three, extended care and local support groups. Four, addiction counseling. Five, all medical care, and some rehab centers may also offer gender and age specific programs. So when you talk about detoxification, is not only removing the drugs from the body, it's actually a complex process in which inpatient treatment, outpatient treatment, support groups, counseling, medical care, and specific goal-directed programs for that specific person are actually the key factors. Detoxification requires minimum of 30-day hospital admission. During the stay, the patient will be offered round-the-clock medical care and comprehensive schedules consisting of counseling, therapy, and recreational activities. Now, this time period varies from center to center. There are some centers which keep people for 30 days, some centers which keep people for 90 days, some centers keep people for 7 to 10 days. I am in favor of short stay rather than keeping them for a longer period of time in an institutional setup where people start getting frustrated, and then as soon as they're out of that institution, they start the process again of addiction. So it's tricky. Group therapy is the key, and lots of literature is generated that group therapy works well. Cognitive behavioral therapy, which seeks to help patients to recognize, avoid, and cope with the situation in which they are most likely to relapse. Multi-dimensional family therapy, which is designed to support recovery of the patient by improving family functioning, day-to-day life. Then motivational interviewing, which is designed to increase patients' motivation to change behavior and to enter into the treatment. Then motivational incentives, which uses positive reinforcement to encourage abstinence from the addictive substances. Then lectures. These lectures are delivered by qualified and well-trained people, and these are focused upon addiction and related issues regarding dysfunctional behaviors, which are helpful for the addict's recovery. And written work. This may include writing about one's life, their addiction history, and formally going through various steps of treatment processes involved in rehabilitation, and holistic activities like exercise, massage, meditation, yoga, and other components of it. But the key is, unfortunately, that all of these treatment modalities should be supervised by trained psychiatrists who would be able to understand the behaviors, the withdrawals, the medical consequences of it, and the treatment. Well, people may disagree with me because some people say that the psychological process is more than the biological treatment, and then they believe that the rehabilitation should be focused more. I believe in everything. I believe that there should be a comprehensive plan including everything, the biopsychosocial model of healthcare. Coming for some treatment, like I won't be going for the treatment for all the disorders, but some of them. Some of them I would be able to highlight here. Rest, we may talk some other time. So sometimes the sedating medication that is given for suppressing withdrawal may elicit process of cross tolerance, like with alcohol. So avoid again cross tolerance, allergies. Then subsequently, short-acting benzodiazepines such as oxazepam at dose of 15 to 30 milligrams every 6 to 8 hours to stage of severity of withdrawals. Usually, again, these benzodiazepines are very difficult to get in Pakistan nowadays. And we are stuck because the policymakers feel that the benzodiazepine addiction is so much that it should be stopped. So they have put a quota system to everything. I don't think so oxazepam is accessible in Pakistan anymore. There was one company which was making oxazepam and it's gone. So that's tricky. You have difficulty in finding the benzodiazepine even for the people who deserves it, which is unfortunate. Anticonvulsants such as carbamazepine. Now, why carbamazepine? Because carbamazepine has the tendency to work on chloride channels, sodium channels, membrane stabilizing effect, sedative effects, anticonvulsant effect. So it is relatively a good drug. So patient can be feeling sedative, calming down effect, relax, mood stabilization, and help in withdrawal symptoms as well. But you can use other anticonvulsants as well. After medical evaluation, uncomplicated alcohol withdrawal can be treated effectively on an outpatient basis. When there are medical problems, a history of seizures, or simultaneous dependence on other drugs, hospitalization may be required. Alcohol addiction treatment, as far as the pharmacotherapy is concerned, disulfiram, naltrexone, and acamprosate. These are the three drugs that are commonly used for alcohol dependence. Disulfiram, unfortunately, is having some hepatotoxic effect. The tablet of 50 milligram is available, and it's available in Pakistan as well, although with difficulty. So 50 milligram tablets after careful monitoring of the physical health, liver status, because substance abuse is already there, so liver is already compromised, so we have to be careful. Dose titration is usually done 50 to 200 milligrams tablets per day, mostly, I believe, but you have to check it out. Naltrexone is again available. It's an opioid receptor antagonist that blocks the reinforcing properties of alcohol and substance abuse, other drugs, opioid related. Chronic administration of naltrexone resulted in a decreased rate of relapse to alcohol drinking and opioids, other opioids as well. Again, it's in a form of a tablet. It's expensive because it is probably not available easily. But there are, I know, some of the companies in Pakistan which are providing naltrexone. So they can be a good source of aid to help these people in getting the treatment. Acamprosate, 333 milligrams capsule and 666 milligrams capsules are available. They actually have a competitive inhibitor of N-methyl D-aspartate type glutamate receptors. It's very good as far as the long-term relapse prevention is concerned. So acamprosate 666 milligrams capsules 2 to 3 times a day can help the people in not having a relapse back again. Heroin addiction, detoxification, as I mentioned to you earlier as well, unfortunately, when you're treating the substance abuse, it's not only one addiction. Most of these addicts come with polysubstance abuse. So they may be using heroin, they may be using hash, they may be using alcohol. They may be using a combination of ecstasy and caffeine and some other drugs. So usually the treatment is complex, and you have to be careful as a psychiatrist to see all the aspects of these addictive things. Buprenorphine is prescribed in rest of the world. Again, difficult to find in Pakistan. But buprenorphine is the newest medication for treating opioid addiction as far as the other drugs are concerned. It binds to the same receptors as morphine, heroin, but does not produce the same effect. Now, the problem with the buprenorphine is that it is itself an addictive compound. So you have to give a bolus dose, then you have to do a maintenance dose, then you have to do a tapering down dose, and whole of this process may take a year or maybe 2 years. If a person is able to afford these drugs, they can be started. The dose can be escalated, zero point 0.1 milligrams to 2 milligrams per day, maybe more, 1 to 2 milligrams or 3 milligrams per day as well, depending upon the severity of the situation. And of course, if there are no side effects, and gradually to taper it off. Methadone therapy. Again, here lots of patients, they do use methadone. Methadone again has been used for more than 30 years to effectively treat opioid addiction. Methadone used for heroin withdrawal treatment. Opioid X 4 to 6 hours, methadone X for 24 to 36 hours. So once a day of a methadone in a form of a tablet. It has the ability to eliminate cravings. It also acts as mu and NMDA receptor used for treatment of heroin withdrawal, can be given for a longer period of time and then gradually tapering it off. So again, 1 to 2 years. Heroin withdrawal can be treated by methadone maintenance therapy, buprenorphine therapy, buprenorphine plus naloxone therapy, or the behavior therapy. There is one more drug, an old drug, clonidine. Again, unfortunately, not available in Pakistan freely. I prescribed it to one of my patients, and he was able to get the drug with lots of difficulty, and it was smuggled and it was very expensive. So we are not using it there in Pakistan. But clonidine is a good drug which can help these withdrawals. I think I am at the end of the situation. Good. So कभी कभी जो तेरे कुर्ब में गुजारे थे, कभी कभी जो तेरे कुर्ब में गुजारे थे, अब इन दिनों का तसव्वुर भी मेरे पास नहीं. मुझे ये डर है तेरी आरज़ू न मिट जाए, बहुत दिनों से तबीयत मेरी उदास नहीं. So I end up this presentation here, and any questions related to the substance abuse, I'll be happy to respond. Although, honestly speaking, I have not done justice to this topic, but this is a very important topic, and probably these drugs, which I have mentioned in the end, you people won't be able to understand and take them in a physical reference actually in Pakistan, because most of them are not available. But in exam situation, they do ask questions related to it, right? So it's important for you people to know that. Okay, anybody, any question?
Sir, I want to ask कि if you are given a patient of substance misuse disorder in exam और opioid withdrawals में है, तो हमारे पास इनमें से कोई भी ड्रग अवेलेबल नहीं है प्रैक्टिकली स्पीकिंग, तो क्या फिर हमने ये बताना है कि जो हम सिम्टोमेटिक ट्रीटमेंट देते हैं या फिर हमने जिक्र करना है कि ये देना चाहिए लेकिन मेरे पास नहीं है तो मैं नहीं दूंगी?
Some key treatment strategies theoretically available हैं. One is called cold turkey. Now, cold turkey method of treatment is that you do nothing. You just shut down the person in a room, lock it up, and do nothing. He will experience withdrawals, severe diarrhea, vomiting, pains, and other things. This is unfortunately very unhuman way of treating an addict. But this is one of the methodology, cold turkey. Cold turkey method of treatment. Second is, again, you give symptomatic treatment that you have mentioning about it, that you try to control the symptoms according to the withdrawal symptoms coming up. Like if he's having vomiting, give antiemetic. If he's having pain, give a painkiller. If he's having diarrhea, give something for diarrhea. If he's having sleep problems, give something for sleep problems. This is again not an ideal way of detoxifying or treating a person. It's a way out when we are incapable of treating them properly. At one end, you say that you should treat people properly, and at other end you don't have the resources to treat people. So this is unfortunate कि एक तरफ तो आपको दवाई नहीं मिलती और दूसरी तरफ आप कहते हैं कि जी इसको प्रोफेशनली आप ट्रीट करें. This is unfortunate, but of course this is a problem. And the third and the ideal way of the treatment is the one that I have again conveyed to you. Theoretically speaking, you should be talking about this. This is the ideal way of treatment, whatever plan we have told you: biopsychosocial model of healthcare, detoxification, appropriate medication, and psychological management as per the guidelines.